The retropharyngeal space, also known as the Gillette space, is a deep neck space that plays a critical role in the spread of infections and trauma-related conditions. It extends from the base of the skull down to the superior mediastinum and is divided into two compartments by the alar fascia. Anatomically, the space is bound by the buccopharyngeal fascia anteriorly, the prevertebral fascia posteriorly, and the parapharyngeal spaces laterally. These facial layers define two main compartments: the true retropharyngeal space, located between the buccopharyngeal and alar fascia, which usually extends only to the T2 vertebral level, and the danger space, between the alar fascia and the prevertebral fascia, which can extend from the skull base all the way to the diaphragm. This danger space allows infections to travel into the mediastinum, making it a clinically significant area. The retropharyngeal space contains loose connective tissue and, particularly in children, retropharyngeal lymph nodes, which drain areas such as the nasopharynx, oropharynx, and middle ear. Now, let's discuss the clinical relevance of this space, starting with one of the most common conditions, the retropharyngeal abscess. This is typically caused by bacterial infections spreading from the upper respiratory tract, oropharyngeal trauma, or even dental infections. Common symptoms include fever, neck stiffness and pain, difficulty swallowing, dysphagia, and in severe cases, respiratory distress may occur as the abscess grows and compresses surrounding structures. Diagnosis relies heavily on imaging. A lateral neck X-ray can show a widened retropharyngeal space, but the gold standard for diagnosis is a CT scan, which can help visualize the extent of the abscess and its relationship with surrounding tissues. Treatment typically begins with intravenous antibiotics, but surgical drainage may be necessary if the abscess is large or compromising the airway. The danger space allows infections to spread rapidly into the mediastinum, leading to mediastinitis, a life-threatening condition. Early recognition is essential, as infections here can progress quickly. Symptoms of mediastinitis include chest pain, fever, and shortness of breath, necessitating immediate intervention. Apart from infections, trauma, like a perforation of the pharynx or esophagus from foreign objects, can introduce pathogens into the retropharyngeal space, creating the risk of abscess formation. Additionally, tumors originating from the pharynx or metastatic lymph nodes may extend into the space, causing symptoms like dysphagia or airway obstruction. Imaging plays a vital role in managing these conditions. Lateral neck X-rays are often used in pediatric cases, especially to identify widening of the space. CT scans offer a detailed view of abscesses, tumors, or foreign bodies and assess the involvement of the danger space and mediastinum. MRI can be valuable in differentiating abscesses from cellulitis and understanding soft tissue involvement, particularly when surgical intervention is being considered. In conclusion, the retropharyngeal space is a clinically significant area due to its anatomy and its role in the spread of infections and other pathologies. Prompt diagnosis and treatment of infections or trauma in this space are critical to prevent severe complications, including airway compromise and mediastinitis. Understanding its anatomical features and clinical implications is essential for healthcare providers managing deep neck infections and related conditions.